Hi, I'm Laura Mooney. I am with the Staten Island Multiple Myeloma Support Group, and I have a question for Dr. Durie today. I understand that 15% of multiple myeloma patients will develop amyloidosis. My question is, should all patients be screened for amyloidosis?
Thank you to Laura for the important question this week, and thank you to Laura for flying in from Staten Island to ask this question in person. So, what is amyloidosis? Amyloidosis is when light chain proteins are deposited in organs and tissues, such as the kidney, the heart, or the skin, or nerve tissue. And this is very important because it can harm the tissues and lead to loss of function, which in the case of the kidneys and hearts is particularly important. And so, in answer to Laura's question, if there is any indication at all that light chains are getting deposited in any of these key locations, then it is absolutely mandatory to do the staining and testing for amyloidosis. If there is light chain myeloma, it is also extremely important to consider the possibility of amyloid, and most doctors will go ahead and run the amyloid staining testing to rule out amyloid. And increasingly, we are realizing that perhaps we are underdiagnosing the occurrence of amyloid in patients with myeloma. And so, why is it so important to be considering this possibility of amyloid? Well, this relates to the treatment that we would recommend. If the light chains are causing damage to critical organs or nerves or being deposited in the skin, this means that we need to work as hard as possible to reduce the light chain levels to a low level, if possible to zero. And so this means that if feasible, we should be offering patients who have amyloid deposits the option for high-dose melphalan and autologous stem cell transplant. This is the best way to achieve a complete remission or even a deeper remission in which the light chain levels are very low or zero. And this means that organ damage can be halted in its course. So the diagnosis of amyloid is something which is actually very important in terms of the outcome and well-being and quality of life of the patients. And so thanks so much to Laurie for drawing this to our attention. And the consideration for amyloid should always be on the doctor's checklist. So bottom line, be aware and check. Whenever it crosses your mind, it's a good idea to be following up and getting that important testing done.